Good afternoon, and thank you for joining me for my weekly update. Today I am joined by Dr. Lawrence Lowe, our Medical Officer of Health for Peel, and Fire Chief Tim Beckett, who is also the head of our emergency team. We're now into the third month of the pandemic, that's week 13, and I'm glad to report that cases in Mississauga are stabilizing. According to our Chief Medical Officer of Health, we are likely on the backside of the curve. Finally. We currently have only 319 active cases in Mississauga. Our efforts are paying off. While community spread is still happening in Peel, we have isolated the majority of the new cases to households and workplace clusters. We have launched our first mobile pop-up testing site to make it easier for residents and high-risk workplaces to get tested. This Friday, Peel Public Health will be at the Malton Community Centre from 10 to 6 with their mobile testing bus. If you are displaying symptoms or are worried about exposure or at high risk of getting COVID due to the nature of your job, please get tested. We still have more to do, but I do want to thank Premier Ford for listening to myself, Mayor Brown, and the GTHA mayors on the need for Mississauga to be taking a regional approach to phase 2 of the reopenings. This is the right decision, and it recognizes that we aren't quite there yet in the GTHA. I'm optimistic and I'm confident that we will get there shortly. We too want to restart our economy. We want to reunite families, but only when it's safe to do so and when the numbers, the data, the evidence supports it. If things go well, we will be able to keep our numbers down. Then it's possible that Mississauga might be given the green light by the province to enter phase 2 as early as Friday, June 19th. We will continue to take the advice of our medical professionals and make our decisions based on science and evidence. That haircut, that nail appointment, that beer on the patio, that new tattoo, all must wait a little while longer. Please, don't venture far and wide. Stay local and use this as an opportunity to support made in Mississauga products, services, and businesses. And on that note, I want to thank the province for banning commercial evictions. This is something that I've been calling for, as have all the GTHA mayors for quite some time. Our small businesses are suffering and need our support today, now, more than ever. They're struggling to make their rent, and many are still uncertain when or if they will be able to reopen. I encourage all landlords who haven't already to apply for the Joint Commercial Rent Relief Program offered by the province and federal levels of government. Recovery will take a team effort, and we need to work together to ensure that our local economy can not only survive, but thrive. Earlier this week, I met with my fellow GTHA mayors and chairs, and we unanimously agreed that the approach the province is taking is the right one, and we will help ensure the GTHA will reopen safely. We also stressed the need for emergency support for municipalities. While the federal government pledged some support for cities through its Safe Restart Agreement last week, this funding relies on negotiations with provinces that have not yet been completed. I urge the Premier and the Prime Minister to negotiate the terms of this agreement along with pledging new money for cities hard hit by this pandemic. We are the economic engines, and our survival will be key to helping reignite the economy. We can't be left hanging. Please don't let us fail. A report out by RBC yesterday clearly illustrates the crisis that cities face. Across Canada, they estimate that municipalities' shortfall could be nearly $12 billion this year, that the measures designed to help cities have so far fallen short and need to be repaid. Preventing big spending cuts or tax hikes should be a priority for provincial governments and could be achieved with transfers, direct transfers to cities. Cities will also need to do their part by finding some workable cost reductions. Our calls for federal and provincial assistance are supported by the data. This is not a bailout, but an economic investment in cities that will return many times over to the federal and the provincial governments to illustrate how important our cities are to the economy. Without our transit systems, people can't get to and from work. They need funding. We need funding to adjust our transit to ensure proper physical distancing and to ensure the safety of passengers and our drivers. Our road supports the movement of goods and services and utilities that power and heat homes and businesses. Without safe, well-managed childcare, employees will struggle to return to their workplaces. And public health will need more funding, not less, to continue to manage this virus and to undertake contact tracing. Without help from the federal and provincial governments, cities will be forced to either raise taxes or cut services, the very services that keep our economy running and that promote growth. Now is not the time for politics or a stare down between the federal and the provincial governments. Now is the time for action so that we can get on with the recovery. In the face of this pandemic, we continue to conduct city business and to keep Mississauga moving forward. We today hosted our 11th virtual meeting. And on that note, today in Council, we first voted to make masks mandatory for both passengers and drivers, along with resuming fare collection and front door boarding as of July 2nd. Face coverings such as scarves will be permitted, and this will allow us to recover the much-needed revenue and safely increase the capacity on our buses from 30 to 50%. Secondly, we approved a plan to reopen our weekly Lions Club Farmers Market and the food trucks at Celebration Square. I know many are missing spending time in our beautiful Celebration Square with their family and their friends, and while things won't be completely back to normal this year, we're very pleased to be doing what we can to inject some energy back into Celebration Square. For our weekly farmers markets, access will be controlled, and we will be ensuring proper distancing between vendors, along with controlling the flow of customers. People will be encouraged to wear face coverings, face masks, where social distancing is not possible. Food will be for takeaway use only. Trucks will be operating under reduced hours and will be required to use a food app that will allow customers to order in advance. We're also working on a plan that will allow our hot dog and our ice cream vendors, who you often see in our parks over the summer, to reopen. Pending the input and the approval from our Chief Medical Officer of Health, we hope to have this all operational by the end of June. Third, we approved plans to reopen the city-run summer day camps at reduced hours and with limited capacity in early July should Mississauga move into Phase 2. Strict health and safety guidelines from the province will be adhered to, and camps will look very different this year. Details will be shared as soon as we know more. I will now turn it over to Dr. Lowe, our Chief Medical Officer of Health, to provide us with a brief update on Peel Region's response to the COVID virus. Dr. Lowe.
Thank you, Madam Mayor, and good afternoon. As of noon today, there have been 2,406 confirmed and probable cases of COVID-19 in Mississauga. Of those, 1,881 have recovered, 313 remain active, and 212 have passed away. While cases in the region of Peel have largely plateaued and are starting to slowly decline, Mississauga specifically has started to move into the tail of the first wave. This is an accomplishment that is shared by our community. Even still, as the province has highlighted in the recent announcement on Phase 2 reopening, it's important to review the ongoing goals of our pandemic response. They are, to the greatest extent possible, to prevent sickness and save lives, to protect our healthcare system, and to minimize the societal and economic impacts of COVID-19 on our community. I know that families, especially those who have residents in senior settings, have lost loved ones to COVID-19, and our hearts and thoughts are with them. I do want to say, though, that we have largely achieved our first two goals here in Mississauga. To succeed on the third goal, it is important to reiterate what we need to do in order to put COVID-19 firmly behind us. And given my penchant for analogies, I will share the following. When we first took our first steps together in March, COVID-19 was like a massive snowstorm. We quickly moved to close the highway to prevent a massive pileup. In pandemic terms, we sacrificed and shrunk our bubbles to reduce interactions and risk. The worst of the storm having passed, the snow is still steady, and we are now learning to drive again in a new world. We learned that staying 2 car lengths apart helps to reduce risk, much like diligence with physical distancing does. We've learned that clean windshields help to keep us stay safe, just like clean hands. We've learned to wear a seatbelt so that if all else fails, we are still staying safe, much like wearing a non-medical mask is the last line of defense in keeping others safe if we can't distance. And we've learned to move our car out of the way if we do crash, just as staying home and getting tested when sick helps to reduce transmission. We always knew that closures were never going to be permanent. They were meant to bring things under control and avert a catastrophe. And we have mostly done that. And now we know what we need to do as we drive forward. The 4 core behaviors of keeping apart, wearing a non-medical mask where you cannot, washing your hands, and staying home and getting tested if sick are the keys to getting into our lives again in a new normal. And as we gradually reopen, we all need to do these core 4 behaviors every minute of every day. We also need business owners and community leaders to step up and make their operations and premises ready to help us take these precautions. And if despite our best efforts, transmission still occurs, public health and our healthcare partners are there to test, trace, isolate, and treat, as we have always done, and as our pop-up testing site will be doing in Malton on Friday. So we prepare, for as the rest of Ontario goes forward, it will soon be our turn. And to adapt a lyric from one of my favorite Springsteen songs, even if the highway is soon filled with broken heroes on a last chance power drive, we know what we need to do to put COVID-19 fully in the rear view and get over this first wave. Let's do this, Mississauga, onwards into a new normal. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. We all love Bruce Springsteen. I want to close once again by thanking my residents for your patience and for your understanding. I know these last 3 months have not been easy, and I ask that you continue to make smart decisions. Keep your distance, wear a mask when it's not possible to physically distance. Everyone has a responsibility and a civic duty to help control the spread of the virus moving forward. The government cannot and should not police your actions. You need to exercise common sense, good judgment, keep your distance, safe, proper hand hygiene, avoid touching your face, wear a mask when physical distancing is not possible. Also, avoid gatherings of over 10 people and continue to maintain a safe physical distance. I think I've said that 3 times, Dr. Lowe. We are now entering a new reality as we begin to reopen the economy. To avoid a larger second wave in the fall, we all need to get used to living a little bit differently. This is our new normal. I want to thank you all for joining us today, and I am willing to take questions from the media. Thank you.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie.
Hi, Ashley.
So my question is kind of, I know today at Council you were talking about having a report prepared that will talk about how the city will handle patio expansions as restaurants are eventually able to reopen in the city. I was just kind of wondering if this means that every restaurant with a street-facing entrance will be able to expand, say, into the parking lot or into the outdoor space in front of them. And if a restaurant's property manager or landlord tells them that they can't expand into the parking lot, will they have any recourse or assistance from the city to ensure that every restaurant that can make a patio can create a patio?
Certainly, Ashley, these are all excellent questions, which I think will all be explained next week in the report. There are some legislative requirements that we need to meet. Obviously, if we had the opportunity, the ability to, we would do public consultation, but time is tight, and we want to get some of these restaurants back open and operating, so we'll do what we can, and hopefully all of the landlords will be cooperative.
Thank you. My next question is for Dr. Lowe.
Hi, Ashley. Go ahead with your question.
So I know over the past few days there's been more reports about how we're starting to see, especially across Peel and the whole GTA, more cases in younger people between 20 and 29. Obviously, with the economy opening up more and our social circles being able to expand a little bit more, what sort of advice or tips would you have for people in their 20s who are the least likely to experience serious symptoms, but who could pass it on to people who could pass symptoms? How would you recommend that they, help curb the spread and protect other people as the economy opens up more and as people are allowed to see their friends and more members of their friends and families than they were before?
It's a great question, Ashley, and I would share that, as you know, the province announced phase 2 of the reopening early this week, and that the region of Peel is not one of the areas that will be going forward this Friday. And a lot of that has to do with the fact that we still see throughout the region of Peel new cases. Granted, Mississauga is certainly starting to get on the tail end, but throughout the region of Peel, we know that there are still new cases that are emerging, and that they are very much emerging amongst those between the ages of 20 and 59, the working age population, which reflects the nature of community transmission that we had seen in March prior to the closures and curtailments. And I think the message I would have for people who are young and who feel that this is not a disease that concerns them is that one of the reasons why we are not able to move forward from phase 1 to phase 2 at this time is because we still have those levels of transmission. So if you go to the core 4 behaviors that I talked about, in terms of distancing, hand washing, wearing a mask where you can't distance, and staying home and getting tested if you're sick, I think those are things that we all need to be doing consistently, every single one of us, so that we continue to push new cases down, keep new cases down, and hopefully be able to move into phase 2 with confidence, knowing that we know how to get into a new normal. So thank you for the question, Ashley.
Mayor Crombie, your next question comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Hi, Mayor Crombie.
Steve?
Question about the province allowing religious institutions to hold services at 1/3 building capacity. Because there are sizable churches, mosques, and temples in the city, are you concerned that gatherings in religious centers could spike cases in the city?
Synagogues, mandirs, you name it. We have everything. Of course, this is always a concern. However, if there's been the loudest hue and cry has been from people who want the opportunity, the ability to pray, to go to their respective places of worship, respective places of religious assembly. So the Premier has decided to allow them to reopen, but at 30% capacity. I have spoken to a number of them. I called my local priest, who is a Monsignor actually, and said it would be a good idea to allow people to register or log in, so that should we have an outbreak, it would be a lot easier for contact tracing purposes if they kept a log of who was in attendance. So that is something I'm encouraging them all to consider, and I know many, many will.
Just to follow up on police budgets, since George Floyd was killed, there's been an uptick in calls to reallocate police budget funds into direct community supports and policing alternatives, including in Toronto, where a motion is before their police service at the end of the month. Is this something that you would consider for the Peel Regional Police budget?
So, Steve, this morning at Council, the issue was raised, and I believe it will be raised again tomorrow at the Region of Peel Council. Defunding police is one of those letters that we are receiving as well here in Mississauga. As you know, the Police Board is run by the Police Services Act, which is governed by the province. And while we welcome motions from Council, it is an item that will be debated fulsomely at the board level. Certainly there's a lot to consider. This is a new movement, and something to consider that sort of the the kinds of services, whether that police have been having to provide, whether they be through mental health, addiction, homelessness, dealing with food insecurity. These are perhaps issues that are better addressed by trained professionals, but that will be an item that will be up for debate and discussion tomorrow at Peel Council and then again at Police Services Board.
Mayor Crombie, your next question comes from Natasha from the Pointer. Natasha, please go ahead.
Hi, Mayor Crombie. I just had a question about how Mississauga is planning on opening up when you are able to. Obviously, all the parts of the GTA are in different circumstances, but do you think that we should be more cautious considering that we are one of the heated areas?
So you are correct that Peel has been one of the hot spots, as we know that 1/3 of all new cases of COVID-19 have been in Mississauga, and yet Peel represents 10% of the population of the province. So we have asked for a cautious approach. We have asked for a regional approach, and I think the Premier has heeded that cry. As you can see, that he's taken a wait-and-see approach in the GTHA. It only makes sense that in the more densely populated areas, the risk of community transmission is greater. The places where there are more workplaces, where more people are employed, the risk of transmission is greater. So it will take us, and has taken us, a little longer to get over the hump and down the other side. But I am a little confident that I'm starting to see very positive signs, whereas I was having 35 new cases every day, and now I'm seeing 25 new cases a day, and now I'm starting to see single digits. So I'm really optimistic. So I look forward to the input that Dr. Lowe will have at the community health table of the other public health units on Monday when they make the decision as to whether or not we will be ripe for opening on Friday, June 19th.
Awesome, thank you. Just a follow-up question for Dr. Lowe.
Certainly.
Hi.
Hi, you said that you were looking at key health indicators, lower transition rates, increased capacity in hospitals, et cetera, and this is all going on a decline. Looking at the data right now, when do you think the timeline will allow us to open for phase 2?
Thanks very much, and this is a great opportunity for me to describe what the enhanced indicator framework is actually showing us. So the enhanced indicators are meant to identify, in the course of reopening, areas within our ongoing pandemic response that may need attention. So for example, if we're finding that testing or tracing capacity is not necessarily where it is, or that viral trends are not where we want them to be, that can help us to inform our decisions and our discussions around aspects of reopening as they go forward, and things that may need to have attention called to them. But I think the more important thing, as I've said in my remarks today, is that we know that the longer we stay closed, that there are economic and social and health issues with that as well. And so what we need to do is we need everyone to be practicing the 4 core behaviors around distancing, around hand washing, around making sure they're wearing a non-medical mask where they can't distance, and staying home and getting tested if they're sick. That is something that all of us need to do, even if it's not necessarily perfect, but we all need to do that in order to go forward with some sort of reopening, while we will keep a close eye on the indicators and try to step in if there is something that seems to be going sideways. So the indicators are meant to guide our monitoring and progress around the reopening, but they are not meant to be a target that we move to in and of themselves. Thank you very much for the question.
Our last question, Mayor Crombie, comes from Khaled from My Second Home TV. Khaled, please go ahead.
Mayor Crombie, a couple of weeks ago, you mentioned that you are considering the body cams for Peel Police. Can you update us on that, please?
Yes, absolutely can. So we live in an era where everyone has a cell phone and is able to take video, and body cameras would allow a full synopsis of what actually happened in an incident or an event, providing greater clarity, greater transparency, and greater accountability. Is my feeling, it's Mayor Brown's feeling, and I'm very very pleased to say it's our Chief Nish Duriapis feeling as well. So we had an emergency meeting to discuss it last week at Peel Region Police Board, and we are going out to public consultation with the Black African community and with the Black Caribbean community, looking for their feedback, looking to listen to them to see if they think it's as important as we do. In this era of defund police, I will share with you, though it is not an inexpensive item. Certainly there is a cost on the capital side and there's cost on the operations side. And in the past, this kind of technology and innovation was very difficult to implement because there were questions about how long videos could be stored, where would they be stored, who would transcribe them for court purposes, etc. So there are certainly a lot of questions that need to be answered. Certainly the funding envelope would need to be found. But we do know that in other jurisdictions and other municipalities, other cities that do have body-worn cameras, we have seen a decline of complaints against police, and certainly it does assist police as well, so that we better understand the version of what transpired at each and every incident.
Thank you. My follow-up with Dr. Lu, please.
Certainly.
Thank you.
Hi there.
Dr. Lu, how are you? How sure or not sure we are about the second wave of corona? And when it comes to plasma used from recovered persons, can you also highlight that? Thank you.
I'm sorry, I didn't catch the second part of your question, Khaled. I apologize.
No problem. Whether you are using plasma from recovered patients.
Okay, great. Thank you very much, and thanks for clarifying. So in terms of a second wave, first of all, we must make sure that we actually put the first behind us, and I think that's really the focus that I was pointing to in my remarks. As we move, at least in the city of Mississauga, towards the tail end of the first wave, it is important for us to remember the knowledge that we've gained in terms of the 4 core behaviors that we must stick to in order to prevent any resurgence, at least of the first wave in the near future. When people talk about a second wave of a pandemic, they are usually referring to after you've seen the activity conclude for a small period of time, a more significant resurgence that mirrors what we just went through in March. And typically with respiratory viruses, that has usually happened in the fall when people tend to go back indoors, etc. The thing about COVID-19 is we are still learning much about it. We don't know how seasonal it is. We don't know, we know there's questions around will it return and in what sort of fashion. But I think the most important thing is that regardless of what we do, until there's a vaccine or cure for COVID-19, it is critically important for us to continue those 4 core behaviors for the foreseeable future until we are certain that we have averted also a second wave. And in terms of plasma, that is a treatment that is certainly being studied. And I know that my clinical colleagues at Canadian Blood Services, et cetera, are in the midst of research studies that are looking at that question. And I would encourage you to direct your question to them. Thank you very much. And I'll pass it back to Madam Mayor.
There are no other questions, Mayor Crombie, so this will conclude today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Our media team will be sharing the link to today's press conference with you shortly. Thanks so much for joining and have a great day. Stay well.